A wave of public dissatisfaction is growing in the UK over immigration policies, public service failures, and national security concerns. Speaking on a recent broadcast, several commentators expressed deep frustration with the government's handling of key issues, especially the housing of asylum seekers, the state of the National Health Service, NHS, and foreign technology risks. Asylum housing sparks. Outrage. A focal point of the conversation was the growing trend of private landlords renting their properties to local authorities for asylum seeker accommodation. One landlord, in a movie described as a principled stand, refused to allow his property to be used for this purpose. Commentators argued that such refusals highlight a broader frustration with a system they see as rewarding profiteering while sidelining the needs of British citizens in urgent need of housing. The concern is that housing supply is limited, and with many landlords opting to rent to the government for asylum purposes, often at premium rates, ordinary British citizens are being left out. This trend, it was argued, fuels resentment and further strains already stretched local communities. The term dispersal is now being used by government contractors to describe efforts to spread asylum seekers across a wide array of towns and villages, often into areas previously untouched by large-scale migration. Critics worry this could significantly alter the character of local communities and provoke tensions, especially in traditionally quiet or more affluent regions like Rutland. Unresolved border issues and growing numbers. Frustrations over border control were also addressed. The number of small boat arrivals is expected to surge with the warmer weather, possibly exceeding 1,000 in a single day. What once was described by government officials as a negligible issue is now perceived as a national crisis. Many believe the government, both past and present, has failed to grasp the long-term social and economic implications of unchecked migration. It starts small, one commentator recalled, but now it's everywhere. The result, they argue, is a population overwhelmed by the visible and rapid changes in their communities and a sense of helplessness about stopping it. Public perception, they claim, can easily identify new arrivals, often due to their inability to work, lack of resources, or simply the visible signs of hardship. Critics argue that leaving migrants in long-term limbo, unable to contribute, only worsens integration efforts and places further strain on public finances. NHS in crisis, delays, and decline. The NHS, once a point of national pride, is now under fire for unacceptable wait times and poor outcomes. One caller recounted an operation scheduled for 2027, a delay that commentators described as disgraceful and unheard of in other developed countries like Germany, France, or Australia. Experts highlighted that in many cases, patients with cancer or other life-threatening conditions are forced to endure long waits for scans, diagnostics, and consultant appointments. These delays, they say, drastically reduce survival chances and treatment effectiveness. While official wait time targets exist, the backlog in nearly every stage of the patient journey, from first symptom to treatment, renders those standards meaningless. Britain's cancer outcomes now lag behind those of its peers, and many attribute this decline to years of underinvestment and, more recently, the disruption caused by COVID-19. Some commentators accuse the government of spreading false optimism about improvements in the NHS, stating bluntly, "Nothing works in this country and it's the fault of those who run it." National security concerns over Chinese-made EVs. Adding to the unease is a new warning from British defense companies advising their employees not to charge mobile phones in Chinese-manufactured electric vehicles. The fears that data security could be compromised through this practice. This revelation was described as astonishing and raised broader concerns about the UK's dependence on foreign technology, especially from countries with known track records of espionage. Commentators criticized the government's past naivety, arguing that officials have failed to anticipate the cybersecurity risks associated with widespread use of foreign-made tech. A growing sense of powerlessness. Across these discussions, a recurring theme emerged. The public feels increasingly powerless in the face of systemic failure. Whether it's mass migration, deteriorating health services, or growing international threats, many believe the British government, regardless of political party, has failed to act in the national interest. There's a call for accountability and urgent reform. As one commentator put it, the people running the country are not serving the people of the country, and the country is breaking as a result.